Hi everyone, Dr. Syra here, Naturopathic Doctor of Vitamart.ca. Today's video is on how to overcome the winter blues, also known as Seasonal Affective Disorder or SAD. So we'll start off discussing what SAD is, we'll talk about how it can develop, we'll talk about some of the symptoms that are associated with seasonal affective disorder, and then we will end off providing you with 5 tips on how you can protect yourself from developing SAD. So many people around this time of year tend to feel the winter blues coming on. Now, a lot of people will attribute this lower mood to a decrease in sunlight exposure. However, science has proven that this lower mood or winter blues can actually be due to a more serious condition known as seasonal affective disorder or SAD. SAD is a form of depression that follows the seasons, and so it begins in early fall and can go up to early spring. It increases in prevalence the further you move away from the equator. So about 15% of the Canadian population suffers from a form of the winter blues, and about 2 to 6% of these people will actually suffer from full-on seasonal affective disorder. Now, it is about 4 times more likely to happen in women than it is in men, and age of onset is about 18 to 30 years. It develops as a result of the shortening of daylight hours that happens in the winter months that causes a shift in your normal circadian rhythm. So your circadian rhythm is your internal 24-hour biological clock that is responding to the light and dark changes that is happening outside every day throughout the seasons. And so people who have seasonal affective disorder have a disrupted circadian signal, and so they get a imbalance in hormone production. So normally you will see increased melatonin, increased cortisol, and decreased serotonin levels. So this increased melatonin will increase your desire to sleep more. This increased cortisol will make you feel a little bit more agitated. Individuals can experience SAD at varying intensities and for different periods of time. So no two people will experience SAD in the exact same way. Also, since in the winter months there is decreased exposure to sunlight, people with SAD have a harder time synthesizing vitamin D because vitamin D is mainly made from the sun. And there has been a link to vitamin D deficiency and depressive symptoms. Well, you can definitely feel increased sadness and lower mood. You can have increased desire to sleep. You can also maybe experience some mood swings. You may also experience increased appetite, increased agitation, and also social anxiety can come along with it. So when it comes to conventional medicine, mainstream approach involves antidepressant medications. When it comes to alternative interventions, treatments are more multifaceted in its approach. And so we will look at diet and exercise protocols, we will look at meditation, possible mindfulness practices, also look at supplementation if necessary, and then possible light therapy. So now I'm going to provide you with 5 tips on how you can protect yourself from developing seasonal affective disorder. So tip number 1 is light therapy. So light therapy works by replicating the effects of natural sunlight, but uses bright artificial light instead. And so this bright light stimulates cells in the eye that are connected to a part of your brain that helps to regulate your circadian rhythm and bring it back to baseline. And so light boxes can be purchased to emit full spectrum light that resembles natural sunlight. Now, all you need to do is sit in front of a light box, whether it's 10,000 lux of white light first thing in the morning for 30 minutes, or it could be 2,500 lux white light for about 2 hours a day. Now, the best part about this is you can be doing anything while having exposure to this white light. So you could be eating, you could be watching TV, doing some work, really anything. It's just important to note that since this light therapy is quite energizing, do not do it close to bedtime because it can really affect the quality of your sleep. Tip number 2 is vitamin D. So low levels of vitamin D have been linked to depressive symptoms. Now, how do you know if you have low levels of vitamin D? Well, all you would need to do is get some blood work done to assess your 25 OHD levels. If it comes back that you are below 25 nanograms a milliliter, you are most likely deficient in vitamin D. Now, in the winter months, people living further away from the equator have a harder time making vitamin D, as I said earlier. And so people who have seasonal affective disorder are most likely deficient in vitamin D. So what can you do about this? Well, there's a couple of things you can do. Number 1, you can take short walks during the day to get exposure to sunlight. Number 2, if you are just at home, try to sit in front of a window if you're doing work or watching TV. And then number 3 is if you just want to increase the amount of light getting into your home, just leave your blinds open for as long as you can. So if you still feel like you need more vitamin D, supplementation is always an option. Now, I do recommend getting your blood work done before supplementing because dosage can really depend on how deficient you are in vitamin D. And dosages can vary from about 1,000 IU a day to about 10,000 IU a day. Now, because vitamin D is a fat-soluble vitamin, you can take too much vitamin D. And intoxication usually begins if you're taking more than 50,000 IU a day. So tip number 3 is nutrition. The foods we choose to ingest play a really big role in manufacturing of hormones that are used to optimize brain function. And so people who have SAD tend to crave carbohydrates quite a bit, possibly as a means to raise serotonin levels. But it's important to note that excessive carbohydrate consumption can cause an imbalance in blood sugar levels, which can then cause you to crave more and also create more lower energy for you. And so it's really important that the foods you choose to eat are high in protein, high in healthy fat, low in sugar, and lower in starch. Examples of healthy fats include eggs, coconut oil, olive oil, flax seeds, and fish oil. And so protein is also really important to support serotonin synthesis. You want to aim for about 0.8 grams of protein per kilogram of body weight. Really, that does depend on your activity levels. So it's really important to have well-balanced meals throughout the day. Each meal should consist of a protein and a healthy fat. Overall, diets that are higher in protein, vegetables, complex carbohydrates, and lower in processed foods can really make you feel more energetic and in a better mood throughout the different seasons. Tip number 4 is exercise. Exercise is a really powerful tool to help boost serotonin and endorphins in your body. Exercise can really help to alleviate feelings of stress and anxiety, all while bettering your mood. And so benefits of regular exercise include managing cravings and weight. Exercise can also help to give you sustained energy throughout the day, better quality sleep, better mood through that increase in serotonin levels. And lastly, exercise is just really, really important for your cardiovascular system. So try and aim for about 30 minutes of exercise about 5 to 6 times a week. So the 5th and final tip is counseling. Counseling plays a really important role in supporting people who have seasonal affective disorder, specifically a technique called cognitive behavioral therapy, or CBT. This technique can really help to break down issues that can seem very overwhelming and stress-provoking and change the way that people respond to these negative emotions and feelings. Alongside counseling, meditation practices and mindfulness is really important to achieve optimal mental health. It just takes 5 minutes a day to really unwind and withdraw from your external environment. Guided meditations done either 5 minutes before bed or at any point during the day can be really helpful to alleviate stress. If you are one who doesn't like meditations, breathing practices are also a great way to relieve stress and anxiety. So my personal favorite method is called 4-7-8. So what this involves is for 4 seconds, you're going to breathe in through your nose. For 7 seconds, you're going to hold your breath. And then for 8 seconds, you're going to exhale through your mouth. This technique really helps to get your body and your mind out of the sympathetic fight or flight response and into the parasympathetic calming and relaxation response. Just to recap, seasonal affective disorder is a serious mental health condition that tends to affect people in the fall and winter months. People with SAD tend to experience lower mood, lower energy, increased desire to sleep, and increased appetite. To help protect yourself from developing SAD and to help manage the symptoms, make sure you are exercising regularly, you are eating right, you're getting as much sun exposure as you can, and if not, you're supplementing with vitamin D. But most importantly, make sure to seek support and guidance from your healthcare practitioner. Thanks for listening, everyone. To access the full blog post on seasonal affective disorder, please click the link down in the description. And don't forget to like and subscribe. Thanks, guys.